next, we're going to welcome back Christy Duncan that will be talking about cord blood banking for ALD siblings.
I think one of the main reasons that we're giving this talk is not to be a comprehensive review of cord blood, but there we go. More to talk about the Sibling Connection Program, which we heard about a little bit earlier from Franny. Maybe other people have participated in that. But just as a background, I want to talk a little bit about cord blood and why we talk about saving it, why it can be important in people with ALD, in children with ALD. As far as relevant disclosures, I have helped ViaCord in the past to put together the list of approved therapies for the Sibling Connection Program, which I'll talk about, but nothing as far as research or otherwise. So umbilical cord blood, what is it? So within the umbilical cord, there are blood stem cells that are found there. They're found in the cord and the placenta. Just like those cells that are found in your bone marrow or when we collect peripheral blood, that stem cell, and forgive me, all of you who already know this, but for those who don't, that stem cell, what's really unique about that is it can turn into any of the cells that are part of that blood-forming unit. So if you think about red blood cells, things that carry oxygen, that comes from the one stem cell. The same stem cell makes platelets, the sticky things that help you clot when you cut yourself. It also makes the white blood cells and all of the cells in the immune system. And that's the critical part for people with children with ALD or anyone going through cellular therapies, is that one type of those immune cells can develop, so starts as a stem cell, becomes a type of immune cells, and then differentiates and changes over time, and that cell, after a transplant or gene therapy, can migrate into the brain, cross the blood-brain barrier, and help to prevent the progression of ALD. And so that's why we care all about these stem cells. That's why we're using them in gene therapy or stem cell transplant. So when you hear people talk about a stem cell transplant, it's the same thing basically as a bone marrow transplant. It's just where the cells are coming from. So bone marrow transplant is a stem cell transplant. Cord blood transplant is a stem cell transplant. And so we use these cells. And why did cord blood become an attractive option for people? Well, if you look at the data, there's less graft versus host disease. And so when we think about getting stem cells from another person, one of the problems with those cells is that they've been educated in someone else's body. So one of the interesting things, one of the cool things about the immune system is that it learns. So if you've got chickenpox as a child, you might get shingles as an adult, but you're not going to get chickenpox again because your immune system has learned. It also learns that it's supposed to be part of your body. And so if we just put my stem cells into someone else, if I gave my stem cells to Florian, those stem cells will realize that they're not supposed to be in Florian's body and they'll attack him, and that's something called graft versus host disease. And so when we talk about that matching, and people talk about HLA typing and the matching, what we're trying to do is find an immune system that is closely enough related between the person giving the cells and the person getting that we can let that the person who's giving the cells, they're going to have a less chance of attacking and causing this serious complication of transplant. So earlier, Grady talked about GVHD and attacking his eyes, attacking his liver, and being still a problem. And so that is one of the critical things that we want to avoid in stem cell transplant. So what people have found is that because of the immune sort of naivete of these umbilical cells and other reasons, they cause less graft versus host disease when you compare it to a bone marrow or peripheral blood of someone who is equally matched. So if someone is matched we talk about all these different places we look at, these are just genes that help to control that, recognizing myself from the flu that I'm trying to get rid of. If you're both matched 8 out of 8 places, you're going to have a lower risk of graft versus host disease with cord than you are when you compare that to a bone marrow. And so there are a lot of people in the world who cannot find fully matched donors. There is data that comes out from the National Marrow Donor Program for stem cell transplants, or an article that was published in the New England Journal that shows us within the United States how likely you are to be able to find a match in the United States for transplant. If you are Caucasian of Western European background, you have about a 70 to 80% chance of finding a good match in the donor. If you are anything besides that, it drops off precipitously. So the next group that is most likely to find a good donor is people who are of Native American ancestry, and that's 60%. If you are a Black African American person in the United States, it's 40%. And then, like many people in the world, if you in the United States, if you have not just one thing in your background, it's much harder. So cord blood promise I'm bringing it in. Cord blood is a really attractive option for that group of people who cannot find donors, because you don't have to be as well matched. But it is also not perfect. And so for cord blood, what is being collected from that baby is all you get. You're not going back. So if I have 3 boys, if I had donated their cords, if I was able to donate their cords, people can't in the National Registry come back to me and ask my children to give more cells. That's in the public bank. Private, we'll talk about, is a little bit different. And so it's a limited number of cells. And why does that matter? The amount of cells you need depends on how big you are. And so if you're getting a stem cell transplant and you are a 4-year-old boy, you need fewer stem cells than a 40-year-old man. And so if someone has only collected, whatever amount from the cells, you're probably not going to get enough cells for an adult from a single cord. So there are good things and bad things about every stem cell source we have, but the most attractive thing about cord is that lower risk of GVHD. So how is this done? So probably the most important thing to tell you is that the cord is no longer connected to the child when this is done. The baby is delivered, the cord is clamped, baby goes one way, and the cord goes another way. And the person who is in the labor and delivery room, whether that's a midwife or a physician or other provider, cleans the cord and typically uses a needle to aspirate the cord blood directly into a bag. There are other ways you can do it where you drain the cord, but most commonly people just take it. Then it is shipped. So depending on how or where it's being shipped, it is usually flown, because there aren't cord blood centers in every hospital in the United States. There are not cord blood centers in every, I think they're in every state, but they're certainly not in every city, not in every major place. So usually it has to get shipped somewhere. And then it goes into tanks that look somewhat like this. These are liquid nitrogen tanks where it is frozen until the cord is needed. One question, not necessarily from ALD families, but I get from a lot of people is, should we save my child's cord blood? And so there are 2 different ways you can do that. One is in a public bank. And so this is where the cord is taken, and you've not really probably had to do much before you go into that hospital or wherever you're delivering, whether it's home or somewhere else. The cord is collected and it is shipped to a public registry. There's actually a really big one just around the corner, not too far from here, the New York Blood Center. And those cords can go one of 3 ways. So they either get there and they find the cord doesn't have enough cells, or it's contaminated. A delivery room is not the cleanest place in the world, so is there bacteria or something else, and it could be discarded. It could be used for people who are needing a transplant. So someone somewhere in the world, not just in the United States, who doesn't have a donor, who needs a cord, it can get used for that person. Or in some cases, it could get used for a related donor, but that is not a guarantee. You don't have a hold on the cord. Once you've donated the cord, you don't have a say over where it goes. But if someone in your family happens to need a cord and your cord is still in the registry, you can use it. The other option are the family banks. And that is where, what we heard about earlier, where the child is delivered, the cord is collected, sent to a private bank where it is saved for use for your family at some point in time. So that can either be used as a related transplant, stem cell therapies, or stored without use, which quite frankly is kind of, I think, what we all want. We would never want someone to have to use the cord, but if it's there, you can. There are about 55 cord blood banks in the United States, so I guess my state piece is probably not accurate now that I say that out loud. About half of those are private banks, about half of them, or about quarter, 30, 40% of them are private, and there are some banks that are hybrids, so they can do private collecting and public. We've also had at our hospital where a child has been born who's either gone through PGD and is expected to be a donor for a sibling, where the hospitals can collect and store right in their own repository for use. So most of what I really want to talk about today is the family banking, because that is really what we're going to focus on for people and families with ALD. So as I said, between 50 and 60 banks in the US, they're public, private, and hybrid. In the private banking, and we heard great sort of details about how this worked from Franny this morning, the family typically contacts the bank. The other way this can happen is that you talk to your provider, and the provider will put you in touch with the bank if that provider knows how or goes through that ways. But the communication happens ahead of time between the family and the bank. One thing that I've had families ask is like, do I need to do this weeks in advance? Do I need to do this months in advance? You could, but most of the banks are quite responsive. We just recently at my center for a family with a child who had leukemia, did not have ALD. The mother was scheduled to deliver in, I think, 6 weeks. And so we were going through the process. When we first made that connection, she actually went to labor the next day. And we were able to contact the bank, and that cord got collected. It wasn't easy, but that cord got collected and saved. So people who work at the banks understand the importance of these cells to families and patients. You then, if you are the person donating the cord, you bring that kit to the delivery room. If you have your bag, that kit should be right next to your bag. The medical provider, as I said, collects the umbilical cord blood, and that project is shipped. Typically, and we heard about the costs, there is an upfront fee and an annual storage fee. And then that cord unit gets released to the family when and if it is needed. There are also options if you decide you don't want it to donate it to research or other things, but I think for these purposes, we'll talk about it going to the family. There are a lot of cord blood banks out there, and in many obstetricians' offices, in other places, you'll see sort of the brochure sitting there and trying to, or if you go online, or if you look this up, if you're trying to decide, you're going to see a lot of cord blood banks and a lot of advertising. And so one thing I think people can think about is how do you figure out, how do you choose which one? And these are primarily my opinions about this. So talk to people, talk to your doctor, talk to your midwife. Your obstetrician, if they've done cord blood collection, will have opinions about which companies have been easy to work with, which ones have not, who has come and taught them. A lot of the times the cord blood banks will go to the OBs and do sessions training them how to collect it, because not everyone's ever done, not all obstetricians have done it before, not all midwives have done that before, and the amount that you get is really dependent on who's doing the collecting. So see if they've trained them, if they know how to do it. Talk to your family and friends. A lot of people have saved cords. Talk to stem cell transplanters or gene therapists like myself. We think about this a lot. Other considerations would be the age and the experience of the bank. My bias is that I think cord blood banks that have been around for a lot longer, they may not be any different in how they process the cord. They may not have difference in how they handle, but they've proven themselves to have longevity and have been there for a while. If a cord blood company goes out of business, and this has happened, those cords are typically discarded. And so you don't want that for your family. You've gone through this process, you've made that choice. And that has happened in the past. So go online, find out how long that cord blood bank has been around. Find out how many cords they have been able to dispense. There are accreditations that cord blood banks can get. So there are federal ones, there are state ones, and there are international ones. Go on the website and see if they're accredited. If they're not accredited, don't go with that cord blood bank. Those accreditations are just the standards for how blood products are handled. A lot of them will publish their data about engraftment. So if your cord blood is being used for a transplant, are there enough cells? Do the patients actually recover those cord blood cells after? And then think about the medical screening and restrictions. There are a lot of screening restrictions for public donation that are different and that the private banks don't have to follow. And so look at those and see, is there something that would work for your family or disqualify you? And if so, talk to people and see if there's another one to go to. Timing, like I said, some of these cord blood banks can respond in a moment. Others may not be able to do that. And so just thinking about that timing, look at the cost. They don't all cost the same, and try and choose. And then if you really want to get into the nitty-gritty, talk to them about, or ask someone you know, do they have their own lab? Or are they contracting out? So do they have the product always under the control? How quickly are the cells processed? Cord blood cells, all these cells we talk about, they can't be out in the environment for a very long time. You start to lose that number of stem cells over time. So you want to see if they can process those within 48 hours. Viacord, one of the cords that we're going to talk about next, they have their facility in Ohio, and I remember asking sort of why, how did you pick this spot in Ohio? And it is because what we've been told, it is close to the airport, so it's close to Cincinnati Airport in the relative middle of the country, so lots of people can get there. And then they looked at natural disasters and found that Ohio, as far as earthquakes, blizzards, storms, all the sort of things that disrupt travel, has the least. And we all kind of chuckled at that, but it actually makes a difference. And they built a tornado-proof lab sort of for their cells. So not trying to sell Viacord at anyone, but just think about those things, like practical things. If you deliver in the middle of a blizzard, how's that cord going to get there? And how are the cells shipped? There are shippers that are advanced, that can control the temperature, that can control everything around that. You want that. This is precious. You want that cells, all those cells to arrive in good stead. In this next part about the screening restrictions, this is for the people who Google in the room, who, let's face it, that's probably most of us. When you look up restrictions for who can or who cannot donate cords, there are restrictions put on public banks, and those restrictions are generally in place because of the recipients. So thinking on the other end, someone who's not related to your family, who is getting a transplant for some reason, they want to have a large volume of cells, and they want those to be healthy cells. Typically, public banks will not take the stem cells from twins because each cord has a lower yield, so they won't, or triplets, or however many children, multiple births. So that usually will take that away. Same for premature births, because they often don't get enough cells from that case. If there's immediate family history of cancer, which for a lot of families, if there's a sibling who has cancer, that's the reason that they're donating cells. So that's not a restriction through most private banks. Questions about the maternal health. If you have had a organ transplantation, if you have higher risk for of identified transmittable infections, thinking HIV, hepatitis, things along those lines, you're excluded. HIV and other things would exclude you from a private bank as well in most cases, or I think all cases. And then there are other things, sort of health practices, tattoos or piercings or other things may, depending on when you got those in a public bank, you may not be able to donate. So if anyone's ever donated blood, you know you go through that whole screening question of, have you lived here, have you lived there, what have you done? It's very similar when donating cord blood. And so if there's a question and you're thinking about this, talk to that public bank. If you find out if there's something in your family or your family history that would exclude you. And so now, to talk about what we heard about this morning, something called the sibling connection. And so this is from ViaCord, which is one of the oldest cord blood banks in the country. And this is proactive sibling cord blood banking for potential family future uses in the treatment of ALD. And so what we heard about, and it is still true, is that the sibling connection will store the cord blood of any sibling of a child who has a potentially transplantable disease or disease that can be treated with cellular therapy. And they will save it for free for a lifetime. The baby whose cord is being stored has to be a full sibling, so having the same biologic parents of the child who is in need. And they must have one of the diseases that is currently treatable with cord blood in transplant. ALD is on there. The list is exhaustive. So if you have family friends who have other diseases that might be transplantable, it would apply to them as well. It's a huge, I think it's like a 4-page list of diseases, and they're always looking for more. If you're interested, there's a phone number that's listed here. You can also find it online. It's very easy. You can talk to any one of us, and we can help point you in that direction. There are required forms that need to be completed by the family. When the cells get released, they're completed by the physician. There is a physician form that we just have to verify, yes, this child has a disease that we're going to treat possibly. And then the ViaCord collection kit is sent to the home with a letter to take to the OB to show them some training materials if they haven't done it, but also the kit. And then, like I said, you bring it in. So for this, again, I can't say enough, there is no cost to you. There will never be a cost to you for collection, for storage, for anything else related to cord blood store in this program. There are clinical staff at their site who can talk with you about it. The website is up there. So when it does come time to get the cord released, there are forms that are completed. This is a little bit of the nitty-gritty, but the family does that form. We've also sort of triggered it from the medical side in the past. We fill out a form from the medical side. The family fills out a form. We talk about this all the time as the mother because it's stored under the mother's name rather than child. Afterwards, though, we want to make sure. We assume that there's been no mistakes or swaps in the lab, but we always check that. So typing is done on the cord segment, typing is done on the child again, and we go through that piece. We give the medical team provides the details. They tell you when to ship it, where you want it shipped, all of those things, and then other pieces. So when we say there's a guaranteed payment form, some people see that and say, like, you just told me there's no fee. It's paid for by your hospital. No one's paying the fee to get this shipped. That's coming from the hospital. We request it, and then it is shipped there. The cells are always shipped before you start any sort of preparation for the transplant because we want to make sure that they have arrived and they have arrived safely. So we always see them and we look at them. And so just a final considerations before we talk about this a little bit more. You do not need to know HLA typing before you decide to donate. You don't need to know that baby is going to be an HLA match. It doesn't matter. They will save that cord. If you're doing that because of PGD or other reasons, you may want to, but it's not required. The donor may still need to donate marrow or peripheral blood in addition to the cord cells. And I think, Franny told us that. We saw little Cecily with her collection tubes sitting calmer than any person who's ever given peripheral blood stem cells, I think, on the planet has done. And the reason for that is there's a lot of variability in what is collected at different centers and by different obstetricians. And because the number of cells depends on the size of the person, you may have a child who needs needs more cells than you can in the cord. In those cases, we give both. But it allows you, if you can't perhaps in that case avoid a bone marrow collection or the peripheral blood collection, we still can take less. So the cord is there if you need it. And again, there is also variability between different cord blood banks and the quality, quite frankly, of the cords that we get back. Cords can be shipped quickly, so if something has happened, if your child changes and we're ready to go to transplant tomorrow, we can usually go to transplant quite quickly. And just this last bullet, we don't know in the future if we'll be able to use the autologous cords, so meaning the cord from a child who has ALD or their cord tissue for future genetic therapies. And I talked to Kristen, I can't find you right now, who has saved her child who has ALD, has saved their cord. And 5 years ago, 6 years ago, maybe 10 years ago, we'd be like, oh, we're never going to use that cord. But maybe we will now. Maybe we don't know what's going to happen in the future. And we were recently able to have a cord saved from a child who's diagnosed prenatally as having ALD because we said that potential exists, that we will be able to use that cord someday. So that child's cord is going to be saved in the sibling connection program, even though it's their own. And I think for ALD, that's actually a real possibility to use those cords, but we'll see. And that is it. So if there are questions or thoughts, I'd love to talk about it. I don't know if they supplied information. I thought they were going to, did ViaCord send? They're outside. So if you want to grab one to share with friends or family, there's information about ViaCord Sibling Connection Program outside. Thoughts, questions?
I was just curious, when you do a blood donation, they'll test for certain transmittable diseases. With a cord blood donation, is there any testing done of the mother at the time when they make the donation? And what testing is done at the time of processing when the cord blood is banked?
It's a great question. Typically, there's not testing done prior to the donation. People could have that done. But afterwards, you can request testing to be done. Franny, I know you spoke about this, or speaking about this, can be done of the mother for things like HIV, hepatitis, and those pieces. And we often will do that. That's a requirement for any stem cell transplant donor, period. We don't want to use the cord blood units themselves to do testing because we don't want to waste cells for that type of testing. There's also maternal health history that is taken, so you go through that process as well.
And then just one last question. So if you have a child with ALD and you still have their cord blood, that might be well worth hanging on to in case, for research purposes in the future?
I think so.
Okay, thank you.
Yeah, I think we don't know. Right now, I know we're talking about stem cell transplants and gene therapy, but gene therapy is the autologous process where you get your own stem cells back. Right now, that's just been done on peripheral blood stem cells that haven't been frozen. We don't know in the future if that will change, if we'll be able to use those stem cells. So I think it's worth saving as long as you can. If it's financially an difficulty or hardship, I don't think you're losing anything by not doing that. And you haven't hurt your child if you didn't save the sibling's cord blood or done those things. You still have, hopefully, that sibling who could donate if necessary. But just to think about in the future, this is something that can be done for free. Oh, hi. Hey, Rich.
Given the small numbers of cells, there's a lot of work going on into trying to expand the numbers of cells from cord blood. Do you think that's feasible, or is there any progress being made there? Because I think that could make a huge difference, especially when you start thinking about older, bigger children and being able to get enough cells for them.
Absolutely. So that's a great question. So probably about 10 years ago, maybe a little more recently, there was a huge research focus on taking a cord blood unit, adding things, manipulating the cord unit, and seeing if you could make the cell number larger. Most of those were unsuccessful, but there is a process, a company that I think it was in the fall, actually has an approved process where you don't necessarily boost the cells, but they have ways that you manipulate them to actually improve engraftment with smaller number of cells. And so that is available not everywhere, but you can do that at some cases. I don't think it's been done through a private bank yet, just because of how it's gone through research. Doesn't mean it couldn't be. And so in the transplant world, like everywhere, there's sort of big swings. And cord blood, a few years ago was everything. And now people are thinking about sort of haplotransplants for people who don't have a match or gene therapy. And so it goes back and forth. But there is interesting data, particularly in the rare disease space and the neurometabolic space. And Vinod Prasad, who's here, was participating in a lot of this when he was at Duke, where you can show that cord blood may cross to the blood-brain barrier, stabilize faster than other areas. So I think than other stem cell sources. So the areas where cord blood is still probably more common is this type of disease, so neurometabolic diseases. But I think in the future we might be able to expand the numbers and use smaller units for larger people. Vinod, do you want to comment on that? Feel free to come on up.
So clearly there is a significant role of cord blood transplant in metabolic diseases. We had shown at Duke and many other centers in Minnesota and other centers that that's been useful. In addition to routine cord blood transplantation for some of the metabolic diseases, the expansion program, as you were saying, has clearly been very helpful in hematological malignancy or in blood cancers, where at least one product by NICORD has been FDA approved. There were a number of other procedures that were put in place and went through some clinical trials for metabolic disease as well, including adrenoleukodystrophy, but they did not reach to any conclusion. So yeah, cord blood has a role clearly, and if there is a sibling cord blood available, which is fairly well matched, that can be used. If there is unrelated donor, we have certainly done. At Duke, we had done about 900 cord blood transplants in children, so there is a lot of experience of doing it.
Katie.
I think I've asked you this before, but I'm always, so for people that don't have a known genetic disease, I'm always surprised at how few people have ever heard about donating the cord blood. And even in Boston, where you would think, but it just feels like, especially, for people of different races that have such low rates, it's very frustrating to hear that people haven't even mentioned. And I know I've told you this, I really wanted to donate my daughter's cord blood, and this was many years ago, but you had to deliver between 9 and 5.
Yes.
And I didn't want to donate that bad, so I didn't. But it feels like you're just wasting this
Agreed.
resource. But many of the physicians that work at MGH, like our residents that are
Never heard.
pregnant, if I ask them, have not really been approached about it, which...
It is, and what's interesting, sort of just medical history-wise, when cord blood banks were initially selected for locations throughout the United States, there was effort put into putting cord blood donation centers and banks in areas where people have a greater density of population than are found or represented in the registry. So, the New York cord blood bank, there's one in Oakland, California, there's one in North Carolina. But you're right, it is really tricky because not every hospital has a system where they clearly collect them for public donation. You can talk to the National Merit Donor Program on their site and get a kit from them, but people aren't approached for it necessarily. And in the hospitals, you're right, they have to decide. So if you're delivering, there has to be someone who's going to collect for the bank during specific hours, and they do try to approach people who, based on self-report, may have lower representation in the registries. And so they're trying. I don't know how successful those efforts have been, but I do the same thing. All the residents, all the fellows, everybody, just try to mention it to people. But it's not out there sort of like the blood donation or organ donation or other things. Yeah, there are. No, if you're donating publicly, it doesn't cost you anything. No, and I think that's the, there are countries, when I think of in Germany in particular, where there's a really organized participation where, just like you sign up to donate your organs when you get your driver's license, you can sign up to be a donor and things along those lines. That doesn't exist here. Yes, Miranda?
So if you're a parent, the advice is hang on to the cord blood in case you need it. If there's a situation where, like you said, maybe whether it's not affordable anymore or maybe the sample wasn't enough to be used, rather than discarding it, can that be donated to a research center? Who out there is doing research with cord blood for ALD?
Yes, it can be donated. I don't know the specific logistics of how you move it from there, but the centers, all of the banks are always happy to have that conversation or talk with us about it. I know it can be done. Most of the centers, I would assume, whether they're using cord blood cells specifically for ALD or using them for some other reason, probably can use them. I would just talk to sort of the larger centers that are doing that work. I think there are a lot of products that or a lot of researchers who are looking for cells from people with ALD to learn how to do what's next or how to do it better. We're talking about things like gene therapy and what's good and what's bad and how can we do that better? How can we make it safer? Cord blood hasn't been used for that, but other stem cells have. And so perhaps it is something as an organization we could do is try to get that list of places where people are doing research and would want those cells and try to figure out how to move that forward. I think it's a really great idea. Thank you so much.